Good day, I am Maple K. Muhammad, a student nurse from Davao Doctors College, and for today's return demonstration, I will perform the assessing of cranial nerves. Assessing of the cranial nerves is important to determine if the cranial nerves of our patient is damaged that compromises their ability to sense, such as being able to smell or feel touch. So now let's formally start the procedure. For pre-introductory phase, first is to review the client's previous medical records and doctor's order sheet if available. This is to see if our patient had different assessment prior to this and could be one of our considerations for today's procedure. Next to that is to determine the scope of assessment needed. Prepare necessary equipment. The reason for this is to increase efficiency throughout the procedure. And since we are going to assess for the cranial nerves, we will need the following equipment, such as pen light, Snellen chart, Q-tips, and scented object. Next is to perform hand washing or hand hygiene to deter the spread of microorganisms, then wear gloves if it is necessary. Now that we are done with pre-introductory phase, let's proceed to the introductory phase. So, as we enter the room, we are going to greet the client politely as well as his or her companion, if around, can introduce self and verify the client's identity using the agency protocol. This is to build rapport and making sure that we are giving the right care to the right patient. Then, ask patient how he or she would like to be addressed. So, good afternoon, ma'am. I am Apple, your student nurse for today. Before anything else po, may I know what is your name and birthday po?
My name is Shirhala Shannon Balabaran, and my birthday po is December 26, 2006 po.
Okay, ma'am. So, what do you want me to call you po?
You can call me Ella po.
Okay, ma'am. Ella, thank you po. So, next is to explain the procedure to the client and how he or she can participate during the assessment. This is to gain the patient's cooperation and also provide the client the opportunity to clarify, ask, or raise any concern. So, ma'am, we are going to assess your cranial nerves, which means I am going to touch your face, instruct you to do something and to to follow my instructions po, okay?
Yes po.
Okay, so ma'am, if ever that you have questions, you can ask me anytime throughout the procedure, or you can ask me now before we start po. Is that okay?
Okay po.
So, next is to ensure the client's comfort, privacy, and confidentiality. Make sure that the assessment setting is safe, secured, and free from distractions. We will provide this by closing all the doors and curtains and making sure the temperature of the room is not cold nor too hot. And then position the client to be seated comfortably, and if our patient is woman, make sure to drape the anterior thorax when it is not being examined. So, good afternoon, ma'am. So, since we already closed the doors and curtains, I am going to explain why we did it. So, the reason for this is in order to give you privacy and so that you can be comfortable throughout the procedure. Is that okay?
Okay po.
So, ma'am, is the temperature too hot or too cold?
Tamang-tama na po.
Okay, thank you, ma'am Ella. Now we are done with the introductory phase, which means we will now proceed with the working phase. The first step for this phase is to assess the cranial nerve 1 or the olfactory. We will do this by asking the client to clear their nose to remove any mucus, then close eyes, occlude one nostril, and identify a scented object that we are holding, such as coffee powder or bar of soap. Then let the patient describe the smell. The reason for this is to identify whether the cranial nerve 1 of our patient is damaged, which compromises their ability to smell. So, good afternoon again, ma'am. For this step, I need you to clear your nose, remove any boogers. Is that okay?
Okay po.
Okay po, ma'am. You can use this alcohol swab, ma'am, to clear your fingers po. Okay, thank you, ma'am. So, the next one is, I need you to close your eyes po and then cover one of your nostril. Is that okay?
Okay.
Then I will let you smell a scented object. Then, can you name it for me? Okay. Is that okay po?
Okay po.
Okay, ma'am. Close your eyes. What is the smell po, ma'am?
Opo po.
Is the assessing of the cranial nerve 2 or the optic. So in this step, we are going to check for visual acuity, and this is done by using a opaque card and asking the client to cover their one eye and then read what's written in the Snellen chart. Okay, ma'am. So I will need you to use this card to cover one of your eye and then cover another eye as I instruct you during this step. And then read what is written in the chart, ma'am. Is that okay?
Okay po.
Okay, ma'am. Here po. So, ma'am, we will now start ha. What is this letter po?
E.
This one.
F.
Next.
P.
And this one.
O.
Next.
P.
Next.
F.
Next.
E.
Next.
C.
Next.
E.
Next.
O.
Next.
Z.
Ma'am, can you cover the another eye? This one.
E.
And then.
O.
Then.
P.
Then.
E.
Okay, thank you, ma'am. So, next step is to check for the visual field. We will do this by facing the client directly and asking the client to look into our eyes and then place our hand 2 feet apart lateral to patient's ears. Then slowly move the fingers until the patient identifies them. Repeat this in the upper and lower quadrants. Ma'am, in this step, I will need you to focus on my nose only, okay? And then, tell me if you can see my finger on your side and on your upper visual and down visual. Is that okay?
Okay po.
Okay, ma'am. So now I will now start ha. Just focus on my nose. How about this, ma'am? Can you see?
No po.
How about this?
Yes po.
Okay, on the other side, can you see this, ma'am? Ito.
Yes po.
How about this one, ma'am?
No po.
This one.
Yes po.
Okay. So how about this one? This one?
Yes po.
Okay, ma'am. So thank you. In this step, you're able to have a normal finding, which indicates that the client has 20/20 vision on the right eye and left eye, or on the OD and OS. Then, the client was able to read the Snellen chart 14 inches without any difficulty, and she has a full visual fields. Next step is the assessing of the cranial nerves 3, 4, and 5, or the oculomotor, trochlear, and abducens. So we will do this by checking the upper eyelids while the patient is looking directly at us. We expect that the eyelids should not obscure the vision, and then next is to inspect the pupils and that they should be round and equal in size. Then check the pupillary reaction by shining a light in the pupil and observe for the direct and consensual reactions. Next is to hold our finger about 10 centimeters from the patient's eye and observe for pupil dilation while asking the patient to focus on our nose and the object afar from us or behind us. Lastly is to check for the extraocular movements in the 6 cardinal directions of gaze. This is done by standing 2 to 3 feet in front of our patient and ask the patient to follow our finger as we make a wide H in the air. So, ma'am, I need you to focus on my nose, ma'am. Look directly on my nose. Okay, I will now inspect your eyelids. So, next is, ma'am, I'm going to shine a light, mama. Okay, next is to, I need you to focus on my nose, and then I will ask you, in this procedure, to look behind the object, behind me or the wall behind me. Is that okay? So, ma'am, focus on my nose. Can you look behind me, ma'am? Okay. So, next is to, ma'am, I need you to follow my finger, but without moving your head, okay? Only your eyes. Is that okay?
Okay.
I will now start, ma'am, ha? Okay. Follow this one. Yes. Follow this. Okay, very good, ma'am. Thank you po. So, in this step, we are able to find a normal findings by in her eyelids, the patient's eyelids does not obscure or does not compromises the patient's ability to clearly see the background or the object in front of her, and the pupils of our patient is round and equal in size. When it comes to the pupillary reaction, I observed for direct and consensual reactions, and then I saw that in direct reactions, the patient's pupil was able to constrict when I shoved a light into her eyes, and then for the consensual reaction, I shoved a light into one eye, but then the both eyes was able to give reaction or was able to constrict, which indicates normal. And the next is when I asked the patient to look on my nose, the patient's eye was constricted, but when I instructed her to look for the object behind me, her eyes was able to dilate. And then when it comes to the 6 cardinal directions of gaze, I have noticed no any unnecessary movement of their eyes, which indicates normal, since this unnecessary movements means stagmus or nystagmus, which means a abnormal finding. Next step is to assess the cranial nerve 5 or the trigeminal. This is done by observing the mandibular, maxillary, ophthalmic divisions. Should be tested symmetrically for pain, light touch, and temperature. For pain, use a Q-tip sharp and dull ends. Then ask the patient to close the eyes and stimulate the forehead and cheeks at the points indicated. Use both ends of the Q-tip as we test along the scattered areas, and then compare symmetrical areas on both sides of the face. So, ma'am, in this step, I will instruct you to close your eyes, and then I will point some object, and then can you tell me if you feel if you feel it. Okay, ma'am. Close your eyes. Okay. Can you feel this one, ma'am?
Yes po.
How about this one?
Yes po.
How about this one?
Yes po.
Okay, very good. Next for this is the same, cranial nerve 5. We're going to test for light touch. So with using a whisk of a cotton, we are going to test the scattered areas and then compare sides. In this one, I'm going to use another cotton ball. So, ma'am, I need you to look away from me. Okay? Can you look up, ma'am? Okay. Other eye. Can you look away, ma'am? Okay. Good. After that is now we are going to test for the cranial nerve 7 or the facial nerve. So we will do this by standing in front of our patient, then asking them to smile, frown, show teeth, puff cheeks out, pursed lips, raise eyebrows, and close eyes tightly against resistance. Normally, the patient could do these maneuvers easily. So, ma'am, in this step, I am going to instruct you to do some facial expressions. Is that okay?
Okay po.
So, ma'am, first, can you smile? Okay. How about, can you show me your frown face? Next is to show teeth. Puff cheeks out. Pursed lips. Raise eyebrows. Okay. And then, can you close your eyes tightly po? Okay. Good. So, next thing to do is to test the cranial nerve 8 or the acoustic or the vestibulocochlear nerves. This is to assess for hearing. So we will do this by testing one ear at a time and occlude one of the patient's ears with our finger. And then stand 1 to 2 feet away from the patient and conceal your mouth to prevent lip reading, and test the open ear first by whispering numbers or words that contain equally accented syllables such as 99 or baseball, and then ask the client to repeat what we have whispered and repeat on the other side, other ear. Okay. Ma'am, in this step, I will leave you to stand up and then close one of your ear using your finger. And then I am going to whisper some words. And then at the end, I am going to ask you what word I have whispered. Is that okay?
Okay po.
So, ma'am, can you stand up? Okay. Can you close your other side ear po, ma'am? Okay. So now I'm going to whisper some words and then I will ask you, okay? So, ma'am, what word I have whispered?
99 po.
Okay, good. So how on the other side? Okay. What word I have whispered, ma'am?
Baseball po.
Okay, very good. Thank you, ma'am. Next step is to, again, check the cranial nerve 8. To assess for lateralization, we are going to perform the Weber's test. We are going to use a tuning fork, but in this case, we are going to use a fork since a tuning fork is not available. And then we are going to place the tuning fork at the base of the peribating, at the base on top of the patient's head, and we are going to ask if the patient is louder in one ear or same in both ears. So, ma'am, we're going to put this thing on your center, on your top of your head, and then will you tell me if the sound is heard equally on both sides, or if it is here louder than the other side. Is that okay?
Okay.
Okay, ma'am. Ma'am, can you hear the sound equally or it is louder on the other side?
Equally po.
Okay, good. So next is to perform the right test to compare air and bone conduction. So we are going to place the vibrating tuning fork on the mastoid process behind the ear, and when the patient indicated that the sound is no longer heard, quickly place the vibrating tuning fork near the ear canal and be sure to also check the opposite ear. So, ma'am, in this step, I will put this thing on the behind of your ear, and then will you ask me if the vibration or the sound is no longer heard po? Okay. So, I will now start now, ha. Okay, on the other side. Ma'am, can you feel the vibration?
No longer po.
Okay.
Yes po.
Okay, so, ma'am, what you have observed?
Mas mahaba po yung vibration nung una po.
Okay. So, next is to check for the cranial nerve 9 and 10, or the glossopharyngeal and vagus. So, we are going to ask the patient to say ah and ask the patient and assess the patient's voice. If it is hoarse, does it have a nasal quality, and observe the soft palate and the uvula. The soft palate should rise promptly and symmetrically, and the uvula should remain midline. Then inspect the anterior and posterior pillars and the pharynx. Ma'am, I will need you to say ah, ma'am, and then I am going to observe, okay? Okay, ma'am, can you say ah?
Ah!
Another one.
Ah!
Okay, good, ma'am. Thank you. So, next is to test the gag reflex one side at a time. Using a tongue blade, and after warning the patient, we're going to stimulate the back of the throat, likely on each side in turn. We should see a rise in the palate and other signs of cracking. We are going to ask the patient to swallow, and it should be done without difficulty and regurgitation, okay? So, ma'am, I will test your gag reflex, mama, which means I'm going to put some object on your mouth, and then we will see if you have a gag reflex, ma'am. Is that okay? Ma'am, can you say, can you open your mouth? Okay, so I will insert, okay. On the other side. So, ma'am, can you lift up your shoulder po? Down. Again. Down. Can you look on at your side? Other side po. Okay, good. So, next step is the assessment of the cranial nerve 12, or the hypoglossal. In this step, we are going to ask the patient to open her mouth and assess for tongue atrophy and fasciculations. Then after, ask the patient to stick her tongue out, noting for any asymmetry or deviation from the midline. We expect that the tongue should protrude straight out. So, ma'am, can you open your mouth po? Okay. So, can you stick your tongue out? Okay. Okay, so good. So, ma'am, we are now done with the procedure. I would like to say thank you for your cooperation throughout this procedure, and I would like to clarify if you have any questions po ba?
Wala na po.
Okay, thank you, ma'am. Now, I am done performing the assessing of the cranial nerves. Again, I am Apple K.M. Muhammad from BSN 111E, Group 19. Thank you!